Hi, my name is Dr. Matthew Haluch from Baystate Dental. Did you know that 1 in 3 Americans snore? Snoring occurs when the airway is blocked or partially blocked. As the size of the airway shrinks, the net result is vibrations in the throat or snoring. Many times when snoring, the body will continue to receive adequate amounts of oxygen with little or no harm, but it certainly is a red flag for signs for sleep apnea. Snorers or sleep apnea patients are essentially fighting all night for oxygen. This can lead to apneic events where people actually stop breathing anywhere from 30 to 100 times per night. A sleep study should be done to help determine the seriousness of this condition. At Baystate Dental, we have a device that helps with this screening process and can be done in the comfort of your own home. The WatchPat 200 collects data as you sleep. This data is then sent to a sleep physician to aid in the diagnosis and determine if a study at a sleep center is necessary. The gold standard for treating sleep apnea is the CPAP device. In some instances though, your dentist can help you with your snoring. We can create for you a custom appliance that helps open your airway while you sleep, preventing some of the soft tissues from falling in the back of your throat and collapsing your airway. There are a number of different devices out there dentists can fabricate for you. At Baystate Dental, we can help determine which one is right for you. By allowing for more oxygen while we sleep, helping to prevent snoring, perhaps we can improve a patient's quality of life by getting a better night's sleep. We may improve their health by putting less stresses on their heart as they gasp for air each night, and maybe even save a couple marriages from snoring. At Baystate Dental, we have a number of different devices for you, and we can determine which one is right.